Have you heard of fallopian tubes? I'm sure those of you who are planning to expand your family, trying for pregnancy but not achieved the dream yet, a bit worried. I can understand. So many of the couples would have googled a lot of information, right? And I would always tell my patients that do not do a lot of googling, because that doesn't give you clarity but it confuses you more. So it's like a confusion master. Do you agree with this? I'm sure you are going to agree with this. So today I am going to delve into this very crucial aspect of fertility evaluation, that is the fallopian tube testing. If you are someone who has been trying to conceive for a while without success yet, then this video could be a game changer for you. So let's dive deeper into it. The fallopian tubes play a very important role in conception. They are these pathways through which the egg is picked up from the ovaries, and here the sperm fertilizes the egg, and this fertilized egg will travel all along the fallopian tube towards the uterus, and it is dividing at the same time, and it reaches the uterus and it gets implanted. So the journey in the tube is around 5 to 6 days. So any blockages or any issues with the fallopian tube will definitely hinder the process of conception and thereby leading to infertility issues. Hello everyone, myself Dr. Indu from Samrudh Fertility and Urology Center. Let us understand who exactly needs the fallopian tube testing. So as a part of fertility evaluation we do it, or someone who is planning to conceive for a while now and they have not conceived yet, then yes, there are few key indicators or key factors or key parameters which can be looked into and the test can be taken. Number one is history of pelvic infections. If you have had in the past any pelvic inflammatory disease or any infections, then this may have an impact on the fallopian tubes. So the doctor will or may recommend this fallopian tube testing in such a situation, because infection can result into blockages or scarring in the tube. Number two situation is if you've had a previous abdominal surgeries. Suppose you have had a surgery related to appendix, or a condition called as endometriosis, where many of them may take the surgery, or fibroid removal surgery. All this can cause sometimes scarring and adhesions, and that can affect the fallopian tube in such a way that it may affect the conception. So your doctor will definitely ask you to check for your tubes in such a situation. Number three is if you have had a previous ectopic pregnancy. An ectopic pregnancy is a pregnancy in which the egg is actually getting implanted not in the uterus but outside the uterus, which is often more common in the fallopian tube, and this can definitely damage the tube and increase the chance of future pregnancy for such women. So if you've had a previous ectopic in the past, then your doctor will definitely recommend to test your tubes to understand the tubal patency. Number four situation is if it is unexplained infertility. So sometimes couple undergo few fertility evaluations, and then finally if all the tests are normal, no clear cause of fertility is found, then in such cases the testing of fallopian tubes can help sometimes. So if you have been in such a situation, then your doctor will definitely suggest that you go ahead with the HSG test, because that may be one of the reasons for hindrance for conception. The last fifth is prior to assisted reproductive treatment such as IVF. Sometimes the doctor may advise based on some criteria to undergo this fallopian tube test to know that the tubes are all open, patent, and there is no issue, because now the in IVF the fertilization all happens outside the body in the incubator, and then we transfer the embryos. So sometimes in some situation we may have to have this information on tubes. So once this tube testing is done, then what information do you get? So there are many tests available, but one of the commonest tests that is performed commonly is the HSG, that is hysterosalpingography. It's an X-ray test, but for this you need to use a special dye and this dye is injected into the uterus, which then fills into the tube, and at the same time X-ray images are taken. This is one of the simplest and the most cost-effective tests, and it can reveal if your fallopian tube is blocked, which will prevent the sperm from reaching the egg site and also the fertilized egg from reaching the uterus for implantation. In addition to checking for the blockages of the tube, this test can throw light on other aspects or other issues as well, such as if there is any scarring of the uterus, if there is any small mass in the uterine cavity, or if there is any abnormality of the uterus itself. So identifying such crucial aspects is actually helpful because this is going to impact your fertility, and this may require some specific treatment as well. If you are in any of these situations, or if you have been facing challenges to conceive, then it might be a good idea to speak to your fertility specialist, because then they will help you determine if the fallopian tube testing is essential for you or not, if it is necessary for you or not. Remember this, that understanding your fertility health is a very important step towards building a family that you have dreamed of. That is it for today's video, and if you have found this video useful, helpful, then definitely share it with the ones who might need it, with your near and dear ones. And for more content on fertility and women's health, you can watch the same channel. Thank you for watching this video, and I shall be seeing you soon in the next informative video. Thank you.